Hey everyone, welcome back. Today we're taking a deep dive into India's healthcare system.
Yeah, a fascinating one for sure.
It really is.
It's a journey through how their healthcare has been shaped by decisions and leadership.
Right, like governance and all that over the last 30 years.
Over 3 decades, yeah, a lot's happened. And a lot's changing still.
And from what I've been reading, there's some really surprising things happening over there.
Oh, absolutely. Like, did you know they eradicated polio back in 2014? That's huge.
I did see that. That's incredible.
And now they're really leaning into AI and telemedicine,
It seems like they're trying to bring healthcare to everyone, no matter where they live.
especially to those rural areas, which can be tough to reach.
That's what I'm really interested in.
Yeah.
How do those big decisions at the top actually trickle down and affect, like, the quality of hospitals or access to mental health services?
It's complicated for sure, but it's a story worth exploring.
So let's start at the beginning, shall
Yeah.
we? Take us back to the 1990s when things really started to shift.
Okay, so back in the 90s, India made this big move towards public-private partnerships.
PPPs.
Right, exactly, PPPs. It was about opening up the healthcare sector to private hospitals, insurance models, and foreign investment.
So basically, more private companies got involved. But what did that mean for, like, the average person?
Well, it meant more choices. It wasn't just government hospitals anymore. You had private hospitals popping up, often with the latest technology and stuff.
So competition, which could be a good thing, right?
Potentially, yeah, but it also brought challenges like how do you make sure quality care is affordable for everyone?
Right, because more options doesn't necessarily mean better options if people can't afford them.
Exactly. And this is where governance comes in. It's not just about letting the private sector in, it's about setting the rules of the game.
So, like, what kind of rules?
Well, there's the Clinical Establishments Act of 2010, which aimed to standardize healthcare facilities, like minimum requirements for both public and private hospitals.
Okay, so it's like a baseline,
Exactly.
a safety net, kind of.
And then there's the National Medical Commission Act of 2019, focusing on revamping medical education.
So they're thinking about both the facilities and the people working in them.
Right, because you need skilled doctors and nurses, right?
Right.
This act was all about improving training and making sure there are enough qualified healthcare professionals.
And let's not forget about technology. India was already dipping its toes into digital health back in the 2000s.
Oh, absolutely. They were early adopters of things like health informatics. That laid the groundwork for the telemedicine boom we're seeing now.
Right, because you have those huge programs like the National Rural Health Mission in 2005, and then later the National Health Mission.
Those were game changers. They really focused on strengthening primary health care, the kind of everyday health care most people need.
It seems like they were trying to make sure everyone had at least basic health care, especially in rural areas.
Absolutely. Reducing maternal and infant mortality, building up healthcare infrastructure, especially in those underserved areas.
And what about NABH? I keep seeing that acronym pop up.
Ah, that's the National Accreditation Board for Hospitals and Healthcare Providers.
Okay, so what does that mean?
It's basically a quality assurance system.
Like a seal of approval.
Exactly. It tells patients this hospital meets certain standards of care.
So it helps build trust in the system.
Exactly. Then in 2018, they launched the Ayushman Bharat scheme.
Which seems like a really big deal.
Huge. It's often called Modicare, and it's a big step toward universal healthcare coverage. It aims to give health insurance to millions who couldn't afford it before.
Wow, so it's about removing that financial barrier to getting care.
Exactly.
Ambitious, to say the least.
It is, and like anything, it has its challenges.
So we've seen the big picture. PPPs, quality regulations, these massive health programs. It's clear India has been actively shaping its healthcare system.
Yes, and all of this has happened within the context of governance. All these policies, programs, regulations, they reflect the decisions of those in charge.
But governance is more than just creating programs, right? It's about making sure they actually work.
Yeah.
It's one thing to have a plan on paper, but it's another to make it work in the real world, especially in a country as vast and diverse as India.
Absolutely.
There are bound to be challenges.
There always are.
So I guess that's where we go next.
Yeah, we've looked at the ambitious side, the efforts to improve quality, but now it's time to look at the other side.
The obstacles, the things that haven't gone as planned.
Right, the successes and the struggles. That's what gives us the full picture.
All right, let's get into it. So we've seen how India's been tackling healthcare through all these policies and programs.
Right, a lot of action over the years.
But no system is perfect, right?
Oh, yeah.
What are some of the roadblocks they've hit?
Oh, yeah. There are definitely challenges. I mean, India's made amazing progress, but some issues just keep coming up.
Like resources, for instance. Is India even spending enough on healthcare, given its massive population?
That's the million-dollar question, or rather, the billion-dollar question in this case. Right now, they're spending about 2% of their GDP on healthcare.
And that's, like, way lower than a lot of other developing countries, isn't it?
Yeah, significantly lower. A lot of experts argue that it's just not enough to really address the gaps in the system and meet the growing needs.
So where should that money be going? I mean, just throwing more money at the problem doesn't always work.
You're absolutely right. It's about how that money is spent. There's a big push for focusing more on primary and preventative care.
You mean like those basic checkups, catching things early before they become big problems?
Exactly. Imagine a really strong network of community health centers, early detection programs for things like cancer, and just widespread health education.
It sounds like a smarter investment in the long run.
Prevention is key.
And cheaper, too, probably.
Often, yes. And this brings us to another challenge, that gap between urban and rural healthcare.
Yeah, you might have fancy hospitals in the cities, but what about people in those remote villages?
It's a tough reality. Rural areas often lack doctors, nurses, even basic medical supplies. And that's where technology comes in, especially in India.
We talked about telemedicine, but are there other ways they're using tech to bridge that gap?
Oh, absolutely. Think about AI-powered diagnostic tools that can be used in remote areas. Mobile health clinics that travel to villages, even drones delivering medicine.
It sounds like they're turning their tech skills into a real advantage for healthcare.
It's definitely a bright spot, but tech alone isn't a magic solution. Public-private partnerships, those PPPs we talked about, played a role too, especially in building infrastructure. But they need to be managed carefully.
I thought PPPs were generally seen as a good thing.
They can be, but it's all about finding the right balance. Private companies can bring expertise and resources, but you need strong regulations to make sure they're serving the public good.
So it's about making sure those partnerships actually benefit the communities and not just the bottom line.
Precisely. Transparency, accountability, quality standards, those are all essential.
Okay, let's switch gears a bit and talk about public health programs. India's had some big wins there, right?
Absolutely. Eradicating polio, for example, that was huge. It shows their commitment and how effective their immunization programs can be.
And they managed to vaccinate a huge percentage of their population against COVID-19 pretty quickly, too.
That's right. They really leveraged their existing public health infrastructure and expertise to roll out that massive vaccination drive.
But alongside those victories, there are still battles to fight, right? Like those non-communicable diseases, NCDs.
You're right. Things like diabetes, heart disease, cancer, they're on the rise in India, like in many parts of the world.
And those chronic conditions require ongoing care, which can get expensive and complicated.
Exactly. Addressing NCDs requires a whole range of approaches, promoting healthy lifestyles, early detection and treatment, making sure medications are affordable.
And we can't forget mental health either. Even with the Mental Health Care Act of 2017, it seems like access to mental health services is still a big problem.
Yeah, it's a big one. There's a serious shortage of mental health professionals in India, especially in rural areas. A lot of people struggle to find the help they need.
So the need is growing, but there aren't enough people to provide those services.
Unfortunately, that's the case. To tackle this, you need multiple approaches. Training more psychiatrists and therapists, integrating mental health care into those primary healthcare settings, and just breaking down the stigma around mental illness.
And technology could help there too, right? Like with telepsychiatry and online mental health resources.
Definitely. Telepsychiatry especially has the potential to connect people in remote areas with mental health professionals.
So we were saying before, breaking down those geographical barriers.
Exactly. So it feels like India's at this crossroads in its healthcare journey.
Yeah, they've come so far.
They've made incredible progress, but there's still work to do.
The decisions made now are going to shape the health of over 1 billion people.
Absolutely. It's a dynamic situation, constantly evolving.
So, looking ahead, what are some potential areas for improvement?
That's the big question.
Where should India focus its energy to create a stronger, more equitable healthcare system?
Well, there are a lot of ideas out there, from increasing the healthcare budget to really harnessing the power of AI.
Okay, so next we're going to explore those possibilities.
We'll dive into the potential solutions and how India might use its strengths to create a brighter future for healthcare.
The future of healthcare in India.
It's a story that's still being written, full of potential.
I'm excited to see where it goes. Okay, so we've talked a lot about the big picture.
The overview of India's healthcare system.
Right, the good and the bad.
The successes and the struggles.
But I'm curious, how are some of these ideas actually playing out in real life.
That's the exciting part.
Yeah.
Seeing these innovations in action. Like, let's talk about telemedicine, for instance.
Oh, yeah. India seems to be all in on telemedicine, especially with that E-Sanjeevani platform.
It's a game changer, especially for people in rural areas.
In what way?
Well, imagine you're in a remote village,
Okay.
hours away from a specialist. With E-Sanjeevani, you can talk to a doctor in a big city right from your home.
So it's not just about convenience, it's about access to expertise.
Exactly. And it's not just basic checkups either.
Well,
They're using it for specialist referrals, mental health counseling, even managing chronic conditions like diabetes.
wow.
It's really breaking down those geographical barriers we talked about earlier.
And it's government supported, right?
It is, which means it's accessible to a wider population.
That's key for making sure telemedicine isn't just for the wealthy.
Exactly. Now, let's shift gears to another area where India is doing really cool things. Artificial intelligence, or AI.
This is where I geek out a bit.
Yeah.
AI in healthcare is fascinating.
It is, and India's right at the forefront.
Wow.
One area they're focusing on is diagnostics.
Okay.
There are companies developing AI algorithms that can analyze medical images like X-rays and CT scans to catch diseases early on.
Like cancer and tuberculosis.
Exactly.
So it's like having another set of eyes, super smart eyes, looking at those images.
It's all about early detection, which can make a huge difference in treatment outcomes.
And AI isn't just about spotting diseases, right?
No, they're also using it to personalize treatment plans.
So, like, tailored treatments based on your specific needs.
Exactly. The AI looks at your medical history, genetics, lifestyle, all of it, to figure out the best medications or therapies for you.
It's like healthcare from the future.
It kind of is, and India is leading the charge.
But it's not all high tech, right?
No, not at all. They're also incredibly innovative at the grassroots level.
I've always been impressed by that. Their ability to blend high tech with community-based solutions.
Like their ASHA program.
Make sure.
It stands for Accredited Social Health Activist. They're community health workers, mostly women, trained to provide basic health care in their villages.
So it's like having a healthcare advocate right there in the community.
Exactly. They're involved in everything from maternal and child health to immunization drives to raising awareness about diseases.
And connecting people to those government healthcare schemes we talked about earlier.
Right. They're vital for extending the reach of healthcare into those hard-to-reach areas.
It's brilliant, really.
And effective. ASHAs have played a big role in reducing maternal and infant mortality rates.
That's amazing. Now, I want to touch on those public-private partnerships again.
The PPPs.
Right. We talked about their potential, but also the need for oversight. Are there examples of PPPs working well in India?
Oh yeah, lots of them. One that stands out is in dialysis.
Dialysis is expensive.
Very, and it's life-saving for people with kidney failure.
So access is a big issue, I imagine.
Huge. So the government partnered with private hospitals to create this network of dialysis centers.
So the government provides funding and infrastructure, and the private hospitals bring the expertise and equipment.
Exactly. It's made dialysis much more affordable and accessible.
It's a win-win.
It is.
This whole deep dive has been really eye-opening. India's healthcare system is so complex, so innovative. There's no single solution, but they're always trying new things, always pushing forward.
It's all about continuous improvement.
Driven by that desire to improve the health and well-being of their people.
Absolutely.
It's inspiring, really.
It is. So what's the biggest takeaway you'd want our listeners to remember?
From this whole conversation.
I think it's that India's story is one of progress and possibility. They've achieved so much, but they know there's still work to do. Their willingness to embrace innovation, from the high-tech stuff to those grassroots initiatives, that's something we can all learn from.
Well said. It's a reminder that even with huge challenges, there's always room for hope and creativity.
Couldn't agree more.
Thanks for taking us on this deep dive. It's been fascinating.
My pleasure.
And for our listeners, if you're interested in learning more about all the cool things happening in India's healthcare system, I encourage you to do your own research.
There's a lot out there.
That's what the deep dive is all about, right? Equipping you with the knowledge to explore, to question, to keep diving deeper.
Exactly.
Thanks for listening, everyone.
Until next time.